disease or hospitalization, but we can all agree there is simply no room for complacency as far as this virus is concerned. Dr. Sameer Gupta, let me come to you now. Now, even as we talk about the precautions that we need to take, there is also some talk of a possible fourth wave. Can't really speculate on that at this point, but I find what Adar Poonawalla has said absolutely staggering. He seems to suggest that in addition to a COVID fatigue that we've been talking about for 2 years now, there may well be a vaccine fatigue across this country. He says the Serum Institute has stopped manufacturing vaccine doses once their stockpile went up to 200 million doses because there just weren't enough takers for these. He says, I even offered to give them away for free to anyone who wanted them because they were going to expire anyway. And then, of course, he goes on to say we cannot afford to put a price tag on the life of a citizen. One will agree with him 100%, but is this your experience and observation as well? That, even though now everyone above the age of 18 can go and get that precautionary or booster dose, there don't seem to be enough takers. Is that your assessment?
Yeah, Neha, so thank you for having me on the show and thank you for talking about this very important topic. I think first of all, let me kind of agree with what my previous speakers have also mentioned, that it's difficult to go back and it's very easy to go back in time and point fingers and say, this is right, this is wrong, and we should have done this or we should have done that. I think a lot of your health is in your own hands. And I'll give you a small example from what I see in my medical practice every day. I still insist that each and every patient of mine whom I see in the clinic wear a mask, and the family members who are accompanying them wear a mask. And I can tell you out of my personal experience, about 75% of them either don't have a mask or the mask is in their pocket, or they've said, you know what, oh, sir, mask gaadi mein pada hua hai. I have left the mask in the car. Let me just get it. And I actually make them go and get the mask. And I remind them that the COVID is not over. So yes, even though the government has not had kind of reduced the mandate, your health is in your own hand. You have to still wear the mask and use common sense. I mean, now it's been 2 years and we've been talking about do gaj ki duri, mask is zaruri, right? I mean, it's been there on every time you call, you make a call and this comes on your ringtone. Coming to the next point about vaccinations, I think India has done so far a fantastic job of vaccination. With a population of 1.4 billion, we have given almost 100 crore people have received the first dose, and about 85 crore people have received the second dose, and about 1.8% have received the booster dose. Now, we do know that your neutralizing antibodies do go down with time, right? Your neutralizing antibodies do go down with time. Your cellular immunity does still have a significant role. But it is important to get the booster. There have been multiple studies across the world that have shown that a booster dose, or the precautionary dose as we are calling it in India, is beneficial. The time frame for that is 9 months in India. However, other countries, they have reduced that time frame from 9 months to about 4 months, 6 months. So, and given the fact that we have a big stockpile of these vaccinations, it may not be a bad idea for the government to reconsider the 9 months and make it more into a shorter duration. Also, with schools opening, we should also get very aggressive on vaccination of children. As of now, I think 66% of children who are 15 to 18 years school-going age group have received the vaccination, and Corbevax has just come up for 12 to 14 years. Mm-hmm. So it is important for us to vaccinate the children also, because they are the ones who are going to school. And even if they're not going to school, even if they're home, the parents may be going to school. The parents may be going out. So they may get the virus home. They may have a mild infection, but the children may have a little bit more than mild. Mm-hmm. So it's important for us to kind of get more aggressive on the precautionary dose for sure.
We need to get more aggressive on this, but Dr. Sunila Garg, it just doesn't make sense anymore for the government to still insist that there should be a 9-month gap between the second dose and the third dose that we call the booster dose. When Adar Poonawalla, the CEO of the world's biggest vaccine manufacturer, is saying we've stopped manufacturing more vaccines, we already have stocks of 200 million and there seem to be no takers. why is the government, and a lot of these are going to expire very soon, why should the government still insist on keeping this gap to the 9-month level, especially given that all doctors have pointed out that neutralizing antibodies certainly reduce over time?
Neha, now there is going to be a discussion on reducing the gap to 6 months. So that is one thing which is going to help us. So you see, it's not that the government is averse to, we are changing with the times, as and when the situation is coming accordingly, with regard to vaccination, our strategy is also changing. And with regard to the precautionary doses also, it is changing, that we will be, bringing down the gap to about 6 months. So that will be important part which you have to remember. And another thing which I would like to point out in context of children, it is important, though the vaccines are available, but it is important that, at the schools or at the children's, side also, the parents and teachers both have to insist on the COVID appropriate behavior. That is number one, because the children also and the parents also should not be under the impression that once after taking the vaccine, they will be protected against the disease. That is another important thing, because the vaccinations are going to protect us from severe infections and from mortality and all that.
Yes.
So that is where COVID appropriate behavior is one thing which has to be important and which should never have been given up, which is also, and government also, if you will read through the lines, that there will be no fines, but however people can continue. At the same time, WHO issued the advisory along with Government of India. That is important part which we have to remember. And our population is very diverse. As I think my earlier colleague Dr. Mahajan also pointed out, that when we talk about this, we have to be very careful. At least spending 4 decades in the field of public health, I can say that, we have to see that the messages translate into action at the grassroots, because they should not be under the impression that the virus has gone away. We are getting very less cases, there are very few hospitalizations, but this is how the pandemic behaves. Primarily it is, the cases will come up and down, and the way we are getting mutations also, though you see the mutations are not serious, but they're more transmissible.
They're more transmissible, and that can certainly be said about BA2. Luckily, not causing serious infection or disease, but definitely transmissible. Let me go back to Dr. Harsh Mahajan at this point. Dr. Harsh Mahajan, even as we debate whether the government needs to reduce the gap between the second and the third doses from 9 to 6 months, and that is something that Adar Poonawalla also has made an appeal for, what do you make of the other point that Mr. Poonawalla has made about this vaccine fatigue that seems to have set in? What do you think explains this disinterest in people to come forward and get those life-saving booster precautionary doses? Do you believe that just because we've had a good run over the last few months, and as I keep saying, with my fingers crossed, thank God for that, do you believe that people by and large have deluded themselves into believing that the pandemic is over?
This is human nature, Neha, that we've seen, and we've been, giving the vaccination at our center since the beginning. And we've seen that when the cases go down overall, then the number of people coming in for vaccination also goes down proportionately with the reduction of cases. So it does seem that at that point of time, people feel that what is the need for getting vaccinated now? COVID is going. And people somehow tend to forget that, this epidemic, the pandemic, it comes in waves. We've had so many waves over the last 2 years, and we've also always seen waxing and waning. So I think this thinking that I don't need it anymore, I think it's absolutely wrong. We need to be prepared. And it has been shown so very well now that the vaccinated get protected from serious disease, from long COVID, the long-term side effects of COVID, as compared to the unvaccinated. Most of the people going to hospital with the Omicron in the western part of the world, as well as the few numbers that are here in our country, have mostly been those who were unvaccinated. And so we should not forget this. This is information that needs to be hammered in time and time again. And I'm glad that you've taken up this very important issue in your channel. and people should pay heed. And the precaution dose, if the government does reduce the time gap to 6 months or 4 months, I think all those who fall in the category should quickly go and get the precaution dose, because that really helps. And if we are in this good position in India over the last few months, where it seems that Omicron is a very mild infection. Okay, it may be milder than the Delta. It may be more upper respiratory infection as compared to a lung infection. But had this same infection come last year, when we were not vaccinated, when so many of us did not have immunity due to previous infection or hybrid immunity due to a mix of both, we may have seen a very different picture emerge, where many more would have had serious disease and many more would have died. So
Yes.
we need to be very, very cautious and get the precaution dose as early as possible. And needless to say, vaccine does not prevent infection. It may marginally reduce your chance of getting infection, but it saves you from serious disease. It is the mask and
Yes.
COVID appropriate behavior which prevents infection.
I think
And
it
so
is.
that it's an elementary lesson,
Yes.
which it seems we have still not learned.
We've still not learned 2 years into the pandemic. I'm very glad all of you have come on this show and repeatedly explained the basics to our viewers, that vaccines may not protect you from an infection, but they will save your life. They may even, in fact, prevent your hospitalization or serious disease. That's the whole point. But last word to you, Dr. Sameer Gupta. I don't know if there's any way of frankly convincing the anti-vaxxers, but in recent times, have you had a hard time persuading your patients in general to go ahead and get that precautionary or booster dose? Have you heard many of them say, as Dr. Mahajan pointed out, the pandemic's almost over. Where's the need for another vaccine shot?
Absolutely. So, when you're seeing patients, every time with every patient, I have a discussion that, have you gotten your vaccine? Have you gotten your booster? Where are you in the COVID scenario? And many of them have actually asked that, is the booster dose is the precautionary dose really required? The precautionary dose I thought is a precaution. Do I need that precaution? So instead of calling it a precautionary dose, maybe if we call it a booster dose, there might be a little bit more acceptance, because, when you think precaution, you're like, but I don't need that precaution because I'm fine. I'm healthy. Most of my patients do have heart disease, so by definition, they're not that healthy.
Yes.
But that's a perception in their mind that, I'm not sure if I do need the so-called precautionary dose. Maybe if you call it a booster dose, it may be better.
Okay.
So there is definitely hesitancy. And one more important thing is that right now vaccines are available. Like my previous speakers have also said, there are not many takers for the vaccine. The vaccination drive has actually come down a lot.
And the government needs to do a lot more to focus on that. I mean, if there is a lack of awareness, if people are actually asking questions like, do I need that precautionary dose, then surely there needs to be a fresh awareness campaign around this. And it's interesting you say we should call it a booster dose. Well, the whole world calls it a booster dose. But here in India, we like to do things differently, thoda hatke. So we've chosen to call it precautionary dose. But I think it's about time we educated people and told them that, yes, you do need that third dose. Call it what you like. You need it because it's going to save you, it's going to save your life. And yes, another reminder, COVID is not over, the pandemic is not over yet. So please take all necessary precautions, and yes, it's time to mask up once again. On that note, Dr. Sameer Gupta, Dr. Harsh Mahajan, Dr. Sunila Garg, as always, a pleasure talking to all of you. Thank you for joining us. And thanks to the viewers for watching. It's a wrap.